Hi guys, welcome to Plasma. So today we are going to study zonal anatomy of prostate. So on the basis of histologic studies on prostate in early fetal life, prostate was considered as a five-lobed structure when in 1912 Losley he said that there are five bilateral groups of prostatic buds. Okay, five bilateral groups of prostatic buds during the prostatic development or the initiation. Okay, he called these buds as lobes. Okay, so this consideration is now no more into existence because we know that the development of prostate is of emerging and receding in nature, so it is not fixed, right? So we consider that there are three anatomical lobes in prostate until the onset of BPH, benign prostatic hyperplasia or hypertrophy. So, in normal human beings, there are only three anatomical lobes in prostate until the onset of BPH, which are right lobe, middle lobe, left lobe. So, you might have heard from clinicians or surgeons during transrectal palpation of prostate or when they endoscopically visualize the prostate to rule out any anatomical abnormalities like BPH. Right? Now, prostate is a granular tissue which has been divided into again three zones. Okay, three anatomical zones. These zones are transition zone, central zone, and the peripheral zone. Okay, so this is the transition zone, central zone, and peripheral zone. Now we see the features of each zone individually. So it's the central zone. So it occupies 25% volume. Okay. It surrounds the ejaculatory ducts posterior to intramural part of urethra. So it surrounds the ejaculatory ducts posterior to intramural part of urethra. Okay, intramural part of urethra is the prostatic urethra, right? It is conical in shape. So its apex is at seminal colliculus. Apex is at seminal colliculus, right? And it atrophies with age. So as there is progression in age, it starts to atrophy, right? And it is rarely subject to any disease, right? Rarely any disease occur. Okay. Now its features are that histologically it is different from the entire prostate, and it is derived from mesonephric duct. Okay, it is derived from the mesonephric duct, whereas the entire prostate is derived from urogenital sinus. Okay, entire prostate is derived from urogenital sinus except the central zone. Okay, now we'll be talking about the transition zone, right? So this is the transition zone. Okay, it occupies 5% by volume, lies around the distal part of intramural part of urethra. Okay, so you can see its location lies around the distal part of intramural part of urethra, proximal to apex of central zone and ejaculatory duct. Proximal to apex of central zone and ejaculatory duct. Okay. Now it includes smooth muscle of intramural part of urethra. Its ducts enter prostatic urethra below internal urethral sphincter. Now visualize this diagram. This is a diagram of prostatic part of urethra, right? This is the internal urethral sphincter. So we know that there are these are the openings. Okay. So its ducts enter prostatic urethra below internal urethral sphincter and just above ducts of peripheral zone, right? So as the age progresses, it grows in size and there are appearance on lobes on either side of the urethra. Now these lobes, okay, they compress and distort the intramural plus prostatic urethra, right? Now next we are going to talk about the peripheral zone, okay. So this is the peripheral zone. It occupies 70% by volume, okay. It is cup shaped, right? It is cup shaped, okay. Now it encloses the transition zone, okay, transition zone plus intramural part of urethra, okay, and the central zone. Now except the anteriorly the fibromuscular stroma, okay. So except anteriorly, which is the space filled by anterior fibromuscular stroma, okay. Now let's talk about another important thing, okay. The peripheral zone is prone to carcinoma, okay. This is important. This anterior fibromuscular stroma is non-glandular part, non-glandular part, right? So it is the space between peripheral zone, okay, to intramural urethra. So the zonal anatomy has been completed. Thank you.